So you would notice some motion and then like a firm end feel. So there's a term on your handout that says sacral sulcus. You see that under palpation? Okay. Sacral sulcus is not a bony structure. It's more of an area of the SI region that you need to be able to palpate, which is this area. So basically you would palpate PSIS and bring your thumb medial and superior. So where my two fingers are, that's sacral sulcus. Everybody saw that? Right here. Okay. So that's where I'm going to palpate with the next two tests. Are you guys okay?
I feel it.
Say what?
We're all trying to feel it.
Oh, try to feel it on each other. Okay. Derek, can I have you lie down, please?
Yeah.
On your back. These two tests are also described in Loudon textbook. They are written as pain provocation tests, but they're more of like a special stability really type of test. I'm going to have you scoot towards me just a little bit. So I'm going to have you bend your knee. Are you okay if I palpate there? So the easiest, so I need to be able to palpate this sacral sulcus while he's in supine position. And that's why I wanted to show you on model so you know where I'm palpating. So the easiest way to get to that area is find his iliac crest, right? So I always start with a landmark that's easy to find and I know exactly where my hands can go, right? And then I'm going to I'm going to kind of bend his knee over a little bit and then try to palpate his PSIS. Can you pull your shorts down just a little bit? Okay, that's good. Okay. Okay. And when you find the PSIS, my fingers are just medial and superior to that area. But part of the PSIS is still in my around my fingers, right? Does that make sense? So PSIS, and then I'm just medial and superior to it. Does that make sense? Straighten your knee just a little bit. Very good. And you just relax a little bit. And then I'm going to push through his thigh. So I'm trying to give him a superiorly directed force. And this one you don't have to hold for 20 seconds. You kind of push and feel for that motion. And then when I get to the end range, I kind of just hold it there for a few seconds to get a good sense of the end feel. So remember I told you that whether there's a motion or not, and whether you believe in Baghdad or Jam, you will feel the motion on each other. That's the motion I was talking about. So there should be some motion on everybody. It may be different on different people, but from side to side is what we're looking for always. So a little bit of a motion and then firm end feel. And there it does not have a whole lot, but just a little bit, so you should be able to feel a little bit. So that's the superior shape test. Now, we have a posterior one. You can either leave that knee bent, or you can straighten it. And now I'm going to use my hand, or the heel of my hand, and push right over his ASIS, and I'm going to apply a posteriorly directed force. And you're not, just so you know, you're not going to be able to feel as much motion in posterior direction as you do in superior direction. Are you okay with that? Not hurting you. And the reason we're doing it, because of those two arms of the joint, right? Don't worry about which one you're testing with which. I'm not worried about that. But you do need to know that that's why we're testing you in two different directions. You have that short arm and long arm, right? It's not in the direction you think you're testing, so that's why I don't want to get into it too much. But that's why we're doing it in two different directions, applying the force superior as well as posterior. Got it? Okay. We're going to have you scoot to the middle. Okay, before I step away. So that's all the tests of supine. Now we're going to move on to sideline. So I'm going to have you face them. And can you scoot towards me, please? Thank you. Okay, this is a posterior gapping or anterior compression test. It's one of the 5 pain provocation tests. So you do it in sideline. Loudon book kind of shows it like this. This is a little bit hard, even if I lower the table. I don't know if I can push it that hard, so I just use my forearm, and I'll show you that in a minute. But this is how it is shown in Loudon textbook. So you're trying to compress the anterior part of the SI joint. So you're doing one at a time here. So I'm testing the right one here. I'll have to flip them over to the left. But alternative to this is that you use your forearm, and it's pretty much like over his ilium. And then I'm just going to reinforce with my other arm, and I'm just going to lean my body on him. Okay. So my force is down and anterior. Okay. Any problem with that? Okay. How long do I hold? 1 second. And with that, I'm stressing in muscles.